Varicose veins are veins that have had damage to the valves, and so that they can't contain the blood that's within them. So in order to encourage strong circulation in the lower extremities, we would look at, they might want to wear compression socks would be one thing you can do. Avoid sitting with the legs crossed, because crossed legs cause stagnation in circulation. Be aware of and watch out for water retention. This can happen with pregnant women who stand a lot. Remember, gravity is going to be a huge factor. Their body is pumping 50% more rasa and rakta through that circulatory system. And so if they've been really active, if they did exercise during the first trimester, they will struggle less with this during the third trimester. So truly, when we look at that kapha stage, the things we do to balance during the kapha stage will pay us back during this third trimester. If, however, now they're seeing at the end, they've got a waitressing job and they've been on their feet all day, and they come home and their ankles are swollen, that's when they really want to get the legs up the wall, elevate the feet, and allow gravity to support them in bringing the fluids back to the heart. And then if they can, do passive exercise or even gentle yoga stretches and things will help to keep that fluid, the rasa and the lymph, in the bloodstream, keep it inside the vessels so that we don't see the edema or the swelling, and we have less pressure on the veins for varicosities. It says pay a close attention to the thigh just above the knee joint. This is a problem area. And this is on the back of the leg. So if you look for, like if you put your leg out straight, you feel where the knee joint is, and you come up about 3 to 6 inches above that. This is a region that often creates varicosities or where clots may form. If a person is on a long plane flight, they want to get up and walk around. And it's one of those things, the card that's in the back that gives you, in the back of the seat in front of you, that gives you instructions for how to keep blood moving during a long flight. That's there because of someone getting clots. It wasn't necessarily a pregnant woman, but she got a blood clot after a long flight, and she said they should have told her that. So it's very important to point the toes, flex the feet as you're sitting in your seat, and take breaks where you're walking for 5 to 15 minutes up and down the aisle. And nobody minds seeing a pregnant woman do that. If they get a long car ride, take a break, get out, take a walk, do some stretches, do some exercise, feet up the wall, compression stockings, massage the legs. And it says, provided there's not deep vein thrombosis. And you won't know if there's deep vein thrombosis unless you see some significant swelling in the leg. And if you see that significant swelling, you want to refer them to a medical doctor. Because deep vein thrombosis and even these superficial clots, if they move, can become problematic. So anytime there is redness, pain on pressure, you might want them to mention it to their OBGYN. From John's wife, Natalie. She was sitting cross-legged on the floor on Christmas morning, opening presents, playing with the kids. And this was in the 8th month, the varicose vein developed on the leg. And it says it's a genetic thing. All the women in her family have them during pregnancy. Varicose veins really are genetically traced. So if you look at your parents' legs and you don't like them, take care of your legs now to minimize the potential of expression. So she was sitting on the floor like that for 4 to 5 hours without moving, and then mixed that with the heavy food of Christmas, and she developed a clot in the varicose vein. I wonder if she'll tell us more about that. She woke up the next day to throbbing pain in the leg. And she did then got to her doctor. She said, okay, this is not good. I've got this pain. It's in the area of a vein. Let's find out what's going on. The doctor was able to tell her it was a superficial clot. And he advised her simply keep the leg elevated, apply warm compresses, which would allow the clot to break up a little bit, and keep moving. Keep the blood circulating, because that's going to be an important, the body does have mechanisms for breaking down blood clots. It does that on its own. And so it's so important, she mentions, especially with varicose veins, keep moving. Don't apply extra pressure like crossed leg position, and keep the legs elevated when you can. So all these are really good. It's really good advice throughout the entire pregnancy. But it becomes very important in the third trimester to pay attention to the presence of varicose veins. You would still have the mom doing abhyanga in the mornings, so paying attention, we go circular at the joints. But so if imagine this is the back of my knee, I want to get a lot of friction in that, straight at the foreleg, straight shots or straight strokes on the thighs, but I also want to pay attention to this joint and make sure circulation is happening. We spend a lot of time sitting, and we spend that time sitting with our legs like at 90 degrees or with the legs crossed or with the legs bent. And this can be problematic for circulation. So it's especially important for pregnant women to pay attention to how much time are they spending sitting, and look at walking for 15 minutes of every hour. If they're sitting down, not really doing anything, they want to make sure they're moving around, increasing circulation. So we're doing the abhyanga in the morning, we're putting the legs up the wall in the afternoon, and we're walking during the day.